Hello, viewers, and a warm welcome to this special episode of your favorite program, Apunar Sikitsak. As we all know, health is the ultimate wealth. But in the kind of lifestyle that we are all leading, we come across several issues and diseases. And today, we have come up with a very eminent and pertinent issue related to urology and nephrology. And so, to discuss more, we have amongst us renowned and eminent urologist, Dr. Arup Kumar Nath, Chief Consultant and Urologist, Institute of Urology and Kidney Diseases, which is a super specialty hospital coming up in Sonapur, Guwahati. And besides that, he is also the Chief Urologist of the currently running Advanced Urology and Kidney Diseases. So welcome you, Dr. Nath, to the show today. So, posing my first question before you today, since today we are going to discuss mainly about urology and nephrology related issues, and I would also like to congratulate you that you're coming up with your team of doctors with a super specialty hospital dedicated only to urology and nephrology related issues. So, many congratulations for that. So, Dr. Nath, in the beginning, I would like to know from you what is the concept behind which you have come up with this idea of bringing out a super specialty hospital like IUKD?
When I got the opportunity to pursue my super specialty course, that is MCH in urology, in the prestigious BJ Medical College in Ahmedabad. Yes. So I got All India Open Super Specialty 4th rank to got the opportunity to study in that very sought after institute for urological diseases. At that time, what I noticed that people from all over the country, even I got the opportunity to treat many patients, even coming from our region, maybe from Guwahati, Assam, or the Northeast as a whole, to seek for urological treatment at Ahmedabad or Gujarat as a whole. At that time, what I felt that the cause for all those healthcare seekers in the field of urology to that place was because we had two specific urology and nephrology hospital at that moment. One in Ahmedabad located, that is IKDRC, Institute of Kidney Diseases and Research Center, and one located at Nadiad, that is nearly 100 and 120 kilometer, I think, away from Ahmedabad. Two centers, and at that time it were the only centers dedicated to urology and nephrology. And what I also noticed that they had specific hospital for specific subject, like for heart diseases they had UN Mehta Institute of Cardiac Diseases. Then for cancers they had Gujarat Cancer and Research Institute, that is called GCRI. And even for diseases of the women, for gynecology and obstetrics, they had a hospital called Mayfair, and later on it divided to Mayfair and Sunflower Hospital. And I could feel the difference of a multi-speciality hospital offering all the healthcare and a specific hospital of one subject offering the care to that particular diseases or the particular patients. And there is definitely a difference, and it is very specific. And when I came back in the year 2011 to Guwahati, and I started my urological practice in the prestigious downtown hospital for 3 years or so. At that time also, what I felt that though I started so many things for the first time in Eastern India, or you can say in Guwahati or Northeast, at that time urologists were very less in numbers in our place, and at the same time infrastructure was very at a very primitive level. We did not have lasers. We did not have the laparoscopical urological surgery already started.
At this point, I'd just like to pinpoint, but then I know that you have also introduced laser technology related to urology and nephrology, and you are the first doctor in the Northeast, I think we can claim. Yes. We'll come to that at a later stage.
Okay. So when I at that time I felt that we need to have a team, because even if it is a super specialty subject, still there are lots of things to look, like kidney transplantation, female urological diseases, male urological diseases, then the lasers, laparoscopy, robotics, lots of things are coming up even in urology. And for one person to see all those patients and to develop expertise, what actually I always tried for was expertise, and always I wanted to change what is I am doing today. I always want to do it better tomorrow. So yes. I always compete with myself, and that was the idea. Then I gradually developed a team, and at that time I started thinking that okay, we need to have a specific hospital where we'll have our team and concentrating in different subspecialty. So after super specialty is subspecialty. So like I'm now concentrating on lasers. So my co-urologist, Dr. Boisha, he is concentrating on urological cancers, then the stone diseases, and another senior urologist with me, Dr. Arup Kumar Nath, he is concentrating on the male urology.
Dr. Nath, we'll come to this at a later stage, yeah. But as you mentioned a very pertinent point, that competition with self.
Yes.
Now, I believe that this kind of a belief starts right from the childhood. And our viewers would be very eager to know, with such an eminent and renowned urologist sitting with me, how was your childhood and how were you as a child? I mean, that competitive spirit was in you. Please share with our viewers.
So I am from a small village in Kampur circle of Nagaon district. It is in the middle part of Assam. I had a very normal childhood. I used to play a lot with my cousin brothers, and our school was around 3 kilometers from our place. So at that time we did not have any facility to cars, even to a bicycle. So we went to our school on foot, 3 kilometers in the morning, 3 kilometers in the evening. Maybe that may be the reason that I become very fit at that time.
And very hardworking too.
Very hardworking too. And yes, we used to play a lot. And there was a river. Still the river is there, Kapili. So we used to swim and so many things we did. And at that time, few times during childhood we used to develop lots of things like common cold, fever, so many things. So my parents and me got the opportunity to go to the primary health center. And I when I saw the doctor is sitting and the people are like making a big queue and coming one by one, even those who look very gorgeous also were very helpless.
You?
Yes. He like anyone. I recognize few of them, and they also become very obedient and helpless in front of the doctor. And he was so authoritative and listening to the patient's problem. At the same time, he was reassuring that okay, no problem, you will be getting cured with this medicine, or I'm prescribing this test, you come up. So immediately somewhere my imagination,
you, right?
yes, my imagination was like, okay, I'm going to be a doctor.
Okay, wow.
But at that time, because I'm from a family, mainly we were into farming. My parents still they are doing those farming and all. So we did not have lots of educated people in our family. So at that time, I did not know that there is even a specialty, super specialty. So a doctor is, I think, the ultimate thing,
yes.
Which I wanted to be. And then when I completed my schooling.
So after that, yes. So in your 11, 12, basically,
yes,
you took up the science stream.
Yes.
Right.
In that school itself, Kampur Higher Secondary and Multipurpose School, I studied up to HSLC, and then after that, I got selected. I could have chosen any bigger institute like Cotton College or Nagaon College at that time, very renowned. But I decided to study from my place only. We had some economical reservation also. So I studied there and completed higher secondary with some good marks.
Yes, of course.
I got. And then after that I got selected for the MBBS course in Guwahati Medical College.
Okay.
And when I landed in Guwahati Medical College, because I studied in Assamese medium. So initial 6 months or so, and initial 1 year, maybe the first professional, because at that time we had three professional, first MBBS, second MBBS, final MBBS. Yes. So the first exam was it was held after 6 months of landing up in Guwahati Medical College. At that time I struggled because it was totally a change of medium. I needed to appear the viva also.
Also, was it that you had to come across patients also on a daily basis? This is a very practical, medical field is a totally practical field. So you had patients from all around the state and also Northeast, where, where there are so many different dialects and languages, isn't it? Yeah.
Yes. Because in Northeast we have so many tribes,
Yes.
so many people from I think from all the religion,
Yes.
and so many people. But initial days at medical college for 1.5 years, the first professional, we were not allowed to see the patient. At that time, the basic sciences, anatomy, physiology, biochemistry. And after that only I came to know that okay, after MBBS we have courses like MS, MD, MS, postgraduate courses, and super specialty I did not aware of even till my MBBS.
So Dr. Nath, coming now to the field that you specialize in, so like after completion of your MBBS and also MS,
yes.
I think after that you decided to choose this particular field of medicine. Is it urology, nephrology?
Yes. Actually, after MBBS, I again got selected for postgraduate courses. It was like a regular flow because my co-doctors, they all wanted to be a postgraduate. So I studied along and then got selected. Once I completed or almost about to complete master's degree in surgery, then my teachers, they instilled me the belief that you should go for super specialty course. Yes. Maybe I was a little sincere, hardworking. I got good marks.
But
also.
Dr. Nath, why specifically urology? Why not some other branch?
That is the point I want to share. Actually, I never wanted to be urologist. It was my destiny to finally end up doing urology. At that time, when I decided to come out of state for super specialty courses, at that time, Guwahati Medical College it did not have super specialty courses, MD, MS, that's it. So we needed to go outside. So I went to Delhi, and my aim was to do cancer surgery or gastrointestinal surgery. Very demanding. So any entrance you need to be at the top or top 2, 3, 4. True. Maximum 5. Then you get like cancer surgery, onco surgery, or gastrointestinal surgery. So I needed to try at Delhi for 3 years. It was very extensive study. And when I got 4th rank in Ahmedabad, that is open super specialty entrance course, my senior again guided me, my head of the department at Ram Manohar Lohia Hospital. And then he guided me to go for urology. At that time, I got that 4th rank, so I could have chosen cancer surgery or GA surgery, gastrointestinal surgery. So I got my dream. But the teachers at Delhi, they said, no, you should choose urology because Ahmedabad, that institute is the best in country for training, if not best in the world. So if you do from there, then you will be exposed to lots of newer things. So after that, I discussed with lots of people, and everybody said, okay, you can choose urology because urologists were very less at that time at our place. And
so studying in a place, going away from, coming from your native place, then to Guwahati, and then getting so much of an opportunity because of excelling in your studies, and then you are moving to the western part of India. Part. So how was it, that experience? We would like, our viewers would like to know. Because there, I know that is a prestigious institute. And besides that, students from all around the country, and nowadays, of course, globally also come over and study. Yes. So please share your experience of studying during those days in Ahmedabad.
So if I look at the hindsight, and the journey was so beautiful, so fulfilling, I feel, because I studied in Assamese medium, then I needed to study in English medium in Guwahati Medical College. After some time I picked up, Then I went to Delhi, and the medium changed again. We needed to communicate in Hindi.
Yes.
Initially, people were not understanding our tone of Hindi, but gradually again there also I picked up. And then when I got selected to Ahmedabad, again we needed to communicate with patient in Gujarati. So it was tough time initially for nearly 6 months or so, but it is not much different from Hindi. So gradually I picked up to in Gujarati. And if you see now, I'm going to so many places in Northeast, to offer our service locally to the patient. So now I'm going to Barak Valley. Now gradually even now I can speak to people of Barak Valley in their language. So if I see as a person also, I have grown. I feel that I have grown by moving to so many places, by communicating with people. That excellence in my work, in my subject, that is a separate issue. But meeting so many people, interacting with so many people, that I think definitely helped to develop as a doctor.
True. Thank you so much. And also this barrier of language, as we've seen that as much as we gather the experiences, this eventually goes away. And this divide between of the native language and something of an official language doesn't remain at all, right? Yeah. Okay, now coming to specifically the issue of urology. So Dr. Nath, what percentage of patients, or how do you see that in this eastern part of our place specifically? So what is the percentage of patients or people who come with issues related to urology here in this region?
See, urology is a branch. There are lots of diseases, but in our place, if we say in last like 3 or 4 decades or so, even not in Northeast, globally, if you see that kidney stone incidence has come up, and it is increasing with each passing day. Then urological cancers, it is increasing in Northeast like never before, and it is a very dangerous, and I think we need to press the panic button. Kidney stone, because there is global warming, people are taking lots of high protein diet, less waters, cold drinks, more of sugar, salt. These are the reasons for the kidney stones. And people like nowadays, they work for a long period, they go
they maintain a very sedentary lifestyle.
Yes, do not take water. So that is the reason for increasing kidney stones. And for urological cancers, like specifically if I mention that bladder cancer is increasing in northeastern region, and it is very alarming. And in a cancer registry or a report, national report, it is shown that the Northeast is now the cancer capital of the country, and that is very dangerous.
So it's very alarming, isn't it?
Very alarming. And even I have spoken in so many platforms also, so many people who could actually change the status quo. So I urge them that if we could ban tobacco, which is gradually killing our young generation, and this is the cause for cancer. For bladder cancer, see, if a patient comes with suspected bladder cancer, if I ask, do you take tobacco, 99% say yes. So a patient who is having bladder cancer, the number one reason is tobacco. If symptoms may be blood in urine. A patient of middle age, if comes with painless hematuria, no pain but blood in urine, and if I ask, do you smoke, says yes, then immediately the diagnosis will be bladder cancer unless proved otherwise. Okay. If there is no stone, no injury, or no infection, or any other causes of blood in urine, then it will be bladder cancer. So it is very alarming, and I actually in this platform I want to share my experience and ask the people to avoid tobacco, and yourself, and you motivate others also to avoid tobacco.
Also, Dr. Nath, this alarming issue we see is on the rise, not just amongst the adults, but also children and teenagers. I mean, from a very young stage. We see problems of kidney stone or gallbladder and such problems,
yes,
right?
Yes. See, kidney stone, according to the international guidelines, kidney stone is a disease of the young adults. So it is in the 20s up to 40s. So the people from 20 to 40 years, they are more prone to develop kidney stone. But nowadays we are getting like people of 6 months I needed to operate for kidney stone. This is very painful. And like bladder cancer, which is a disease of elderly, the average age of a patient is, according to book, is nearly 65 years. But now we are getting patients of 20-25 years with bladder cancer, and this is, I think, very bad situation.
Very bad situation, absolutely. Institute of Urology and Kidney Diseases, in short IUKD, is the first kidney-related super speciality hospital in northeastern India, based in Sonapur, Guwahati. Under the supervision of eminent urologist Dr. Arup Kumar Nath, IUKD is a modern-day healthcare hospital with various facilities related to kidney diseases and kidney transplantation services. All kinds of laser technology in urology and nephrology related issues are available at IUKD. For the healthcare services and facilities at IUKD, we can be reached at 98641 04444 and 8822 721671. Okay, now coming specifically to this super specialty hospital, for which I would like to congratulate you and your team of doctors.
Thank you.
So, Institute of Urology and Kidney Diseases, a super specialty hospital dedicated specifically to urology and nephrology related issues. So, why is it going to concentrate just on these kind of issues, and why did it come to your mind to make it specifically related to these issues in this part of the region?
As we have already discussed, that urological diseases are on the rise in our northeastern region. At the same time, the kidney diseases like kidney failure, which is again very alarming, and it is increasing every day. Young people are coming with kidney failures. Now, if you see the other side, like diabetes is on the rise, and it will be again, the whole India will be diabetes capital of the world in coming maybe 2 to 3 decades time. Lots of young people are coming with diabetes. So if we, like a kidney stone patient, 25-30 years patient, when we evaluate for anesthetic fitness for this surgery, then we see that blood sugar is high. So this is again not good sign. Young people developing diabetes. So and kidney failure, number one cause is diabetes. And lots of chronic renal failure patient, they needed to go outside for like kidney transplantation and all. And dialysis specialty, maybe 2 to 3 decades time, it was very again not available to all. But now with the very encouraging and very promising step by state government to make dialysis available in all the district hospitals, now even lots of people are getting the dialysis specialty at their place itself. But for kidney transplantation, again the hospitals, there are medical college kidney transplantation now going on regularly, and in some private hospital also we have permission, but the numbers are not up to the mark, and lots of people need to go outside for seeking for kidney transplantation. And if you see a patient who needs transplantation, they need to stay maybe in a center for nearly 1 year or so, 9 months to 1 year. So a patient going outside and staying for 1 year, it is a very big issue, because along with the cost, it is a problem. Huge burden. Again, the cost, and at the same time, the attendance, those people who will be traveling. Because a person who is smart enough to accompany the patient to a big institute, definitely he will be working. Can anyone take leave of 9 months,
not.
1 year? Nowadays not, because there are always competition, and if you take leave, definitely someone else will get the opportunity. So it is a big issue, and we need a center to address all those issues. And as I have already said, that we need a specific center to address specific diseases of that specific subject. So with that idea, I developed my team, and gradually as everything fell into place, and we got a place at near Sonapur. It is nearby to our Guwahati. So we start
So,
constructing.
can I also know like how many bedded it's going to be? Like how many bedded hospital
Yeah, it will be 100-bedded facility, and
initially?
as you have asked that whether it will be concentrating only on urology and nephrology, yes, our main aim is to develop the subject urology and nephrology. Now, these are brother sister subject.
Yes.
One is kidney related medical side, one is that surgical side. So we are concentrating on that, but definitely as it is located just in the highway, so the trauma will be there.
Okay.
Medicine, surgery, some trauma, and basic life supporting, life saving facilities definitely will be there. We'll have ICU facilities, and the rest urology and nephrological care, everything will be there. And as I have already said, that we have group of doctors who will be concentrating on one subspecialty, so that we can compete with the best in the world.
Okay. Okay, Dr. Nath, in the meantime, already with advanced urological and kidney diseases like centers that you have already running here in Bhangagar also. So, along with that and your team of doctors, you hold several camps in different parts of the Northeast. So, please share with our viewers like how the people are benefiting from such kind of camps. Like you go into the remote interior places for their benefit, basically for the patients.
So, as I have said, I have started the urological practice in Downtown Hospital way back in 2011. What I felt that some people coming for evaluation, and when we evaluate, like you have a kidney stone or a bladder cancer or kidney cancer, which I can operate endoscopically or laparoscopically, it was not that popular, or even not started. Laparoscopy was not started before I landed up here. So we evaluate, and after some time the patient, they stop coming to us, and after 3 to 4 months they come for checkup. The
Communication is the main
yes,
problem,
no,
maybe.
operation was done outside.
Oh,
they
okay.
left for some other place, and then coming back for the checkup only. So at that time I felt that even the referring doctors from the periphery also, they used to refer patient to outside places, because the facilities or the care were not available at that time at our place. So we struggled, and then I decided to go to the periphery, so that we can give the urological care to the peripheral people at their place itself, because as you know, economy in Northeast as a whole is not good. So but if we go and offer our service in the peripheral places, like I travel to so many places, Barak Valley, I go to Pasighat, then Tura, Meghalaya, Dimapur, Arunachal, then remote places in Assam like Kokrajhar, I travel, so many places, Difu, Haflang, Kasar, everywhere. So by doing that, what I could feel that initially I started my outreach camp from Golaghat, then gradually it expanded, and now it is such a good feeling that all the young super specialist doctors, they are following my steps, and they are now going to the periphery.
They are so much eager to know and
yes,
work
yes,
under you.
Yes, that model, it become a big hit, if you say, and now earlier people used to come to the like metros and Guwahati to seek super specialty services. Now super specialists are now making themselves available to the district places, or even the smaller places to the district headquarters also. So that way the peripheral healthcare and rural healthcare is getting super specialty services at their place, and people's belief and faith coming back to the treatment in Assam. So by going to the periphery, yes, the belief and the availability, that two things we could definitely change.
Yeah. Dr. Nath, I would also like to know from you, how hopeful are you about meeting the patient's needs through this latest super specialty hospital coming up in Sonapur?
So definitely, yes, that is very important, because we are setting up a big hospital and we are addressing only one super specialty. That is a little risky also. Financially, it should be viable with for all those fancy instrument, machine, and the ambition to meet all these things. We need the support from the patient, but I am hopeful, because honestly we are offering our service for last 10 years or so. We have started so many newer things, we have set so many milestones, and we are helping patient. Lots of patient I have done even for free of cost. Those people who cannot afford the fancy laser technique and all, sometimes we have done it for even free.
Yeah.
So and we are a group. And there is a saying in Assamese that "Maukhe utile guripurar moran na thake." So we are so many educated people along with who are very willing for hard work and dedicatedly will do. Will start working there. So definitely, I'm hopeful, and I'm sure we will try to give the people of Assam a new feeling at our place.
And also, do you have any consideration for people, for especially the weaker section of the society?
Definitely, we have.
Or the needy.
Yes. We have plan for like the specially able, below poverty line patient, and even the journalists also.
Okay.
We are planning to cover them also, because they are working day in and day out for the society, even sometimes not thinking about their safety.
Own
also.
health also.
Yes. Like, see, somewhere there is a earlier, nowadays it is uncommon, but earlier there is a bomb blast, people will flee away from there, but the journalists will go there to collect the news. There somewhere there is some firing, some extremists are there, so the journalists will go there. This is so as a act of bravery, not thinking for their life, and so many now people from the media, they come that we do not get the time to even drink water. Sometimes, like for urinary tract infection for the female, it is a very common cause that they hold urine for long hours. The journalists say that we are working in the periphery sometimes, outside, so we do not get the like convenient place for passing urine also. So sometimes definitely they are also working very hard. We are keeping something for them also. At the right time we'll declare.
Okay.
And we are planning a kidney health card, and there is another our ambitious plan, Brikka Bandhu, will develop even in each and every village. And at the right time again we'll declare, we'll ask people to join by in that capacity also. And again the kidney health card, who will be having it will again get lots of benefit in our place, lots of they will be regarded as a priority customer. So yes, we have lots of plan, because we are always thinking to change the status quo. We always are striving for change.
And it's also like that, the way we gain from the society, from the experience, it's also our duty as responsible citizens to give back to the society, isn't it?
Definitely.
Now, we are almost coming to the end of the program today. So, Dr. Nath, in the end, like, I would like to know from you, like, what are your future plans regarding issues or the dealing facilities related to urology and nephrology, especially through AUKD and IUKD?
Making ourselves available, or our care making available to each and everyone, to the entire Northeast, or maybe the India or Southeast Asia, or as a whole to the world. We want to make our treatment available. We want to lead by example, that something which we will do at our place will be exemplary. It is available to all, affordable to all. At the same time, we are trying to set like kidney transplantation, robotic surgery, and in the years to come, we have like one more thing to establish at our place is cadaveric transplant. So nowadays there are shortage of kidneys, organ, because nearly 2 lakh people having kidney failure at this moment in India, and only 5,000 people are going for kidney transplantation. Rest of the people, they are dying of shortage of kidney, because they do not have family people fit enough to donate their organ. So if we can develop like cadaveric transplantation, which are now effective in almost all the states in southern and western part, but not at our place, it is not yet started. So definitely we are hopeful, because when there is challenge, there are scope for work, there are scope for development. So we'll have to do lots of hard work and convince the government that these things, if starts, will definitely help the people of Northeast, because you see around 7,000-8,000 people die of like even for road traffic accident. If we can use at least half of the organs to the needy, it will be a big scenario.
Thank you so much, Dr. Nath, for sharing so much about everything related to urology, nephrology, and also besides that, viewers, this is a great opportunity with Institute of Urology and Kidney Diseases coming up, which is going to be open since February 2023.
Hoping.
Yeah, we are hopeful. So with that, it will be a great boon to the entire society actually to avail for any kind of issues. So thank you so much, Dr. Nath, for this entire discussion today, everything. And viewers, we really hope that you love the discussion and you're hopeful to come up with more issues. And thank you so much for watching the program.